what is an AMH test?
So an AMH is an anti-Müllerian hormone, which is a blood test that checks your ovarian reserve.
Okay, what is an ovarian reserve?
Your ovarian reserve is essentially how many eggs you have left in your reproductive lifespan.
And so the number that you get from the AMH test, what does that mean?
So based on results, that indicates if your fertility is on par for age, essentially. So if you are fertile or not, and if you're in menopause, maybe approaching premature menopause.
So if you have like a high number, does that mean that you have a lot of eggs in your ovarian reserve?
Yes.
Okay, and if you have a low number, does that affect your fertility?
Yeah, unfortunately, a low number would indicate that you have less eggs left.
Okay, but they could still be quality eggs.
Yeah, definitely. That's not, quality isn't determined with the AMH test.
Wonderful. Okay. So how do you go about getting an AMH test?
So you can get an AMH test done with your family doctor or a fertility doctor if you're already seeing one. You would go to a lab, get your blood drawn, and then results would go to your doctor.
Okay, and how does this stack up with like other blood tests done? Like, is it like a lot of blood, a little bit of blood? Like, is it quick? How does that like?
So this is just like a simple blood draw. It should just be one tube, but there are a series of other blood tests you would do if you were checking to see if you were a candidate for IVF or to be an egg donor, and that can be quite a few tubes. But this test in particular should just be one.
Okay, and approximately how long do you think it takes to get the results?
I would check with your doctor or lab, depending on where you're located, how long that would take. But where we are in British Columbia, we can see results anywhere from a week to 2 weeks.
And on the results for your AMH test, what exactly are you looking for? Is it just a number? Is there other information on that results that you're looking for?
When we're testing AMH for an egg donor, we're looking for a number between 15 and 25 or anything above that. So anything under 15 isn't really adequate for somebody's fertility between the ages of 20 and 30 years old. So something between 15 to 25 is more accurate for somebody within that age range. And anything even over 25, that could indicate really high reserve or somebody who has polycystic ovaries. Yeah, we can see numbers, 40, 60s. I've seen as high as 90. And that can be with really young women, like teenagers, but also, even into your 30s, depending on the person, right? So, but yeah, that number is going to range from something like, 0.2 if you're infertile, 1, 2, 3, anything below 5 is what infertile patients' numbers are kind of looking like, and then going up from there.
And intended parents often ask for that kind of number, is that correct?
Yeah, intended parents coming into the Her Helping Hub and Egg Donor program are getting AMH numbers right off the hop. And I find that's something that provides peace of mind. I think most IPs are looking for that.
Does everybody who's considering IVF or who wants to become an egg donor have to have an AMH test?
AMH is just like standard protocol screening for our agency at least, and I don't know any doctors that wouldn't test for it. I think that's basic screening across the board with any Canadian or American clinic to test AMH. I think it's quite standard worldwide, but I'm not as familiar with the screening protocols in other countries, but even when we're doing cycles internationally, we're sure to check AMH.
Is the AMH test the only medical test needed to see if someone qualifies to become an egg donor?
There's other tests in addition to that that would be done for donor screening to ensure someone's a candidate. So this is just kind of like the very first basic step. Okay, that looks good. Now, we can consider testing you more, but if you're not able to, if your number is not within a certain range for this basic blood test, then there's no point in doing further testing because it's also expensive.
Okay, perfect.